Bismillahirrahmanirrahim. I am Maria Mehboob, lecturer at the Department of Rehabilitation Sciences, Faculty of Allied Health Sciences, University of Lahore. Today my topic of discussion is hearing aids. What are the hearing aids, component of hearing aids, styles of hearing aids, types of hearing aids, and how we can maintain hearing aid. First of all, we should know about what is a hearing aid. As the name represents hearing aid, hearing is related to audio or hearing. Aid is which enhance your amplification that helps to listen normally. So hearing aid is an electronic device usually worn behind the ear by a patient who is facing hearing problem. Then what are the components of hearing aids? There are basic component of hearing aids are three: microphone, amplifier, and receiver. How they work: microphone pick up the sound, then amplify that sound, and then receiver convert back it to the from electrical signal to the acoustic signal. Through an ear mold, a patient can receive the signal in the ear canal. This is the working of hearing aid. This is basically, you can see a picture of hearing aid. There are some component of hearing aid that is denoted by names: ear mold, and a hook, and a microphone, program button, volume control, and a battery compartment. A hearing aid works through battery because battery is a power supply at which the hearing aid works. Then again is a picture of hearing aid. Then we came across the types of hearing aids. There are two major types of hearing aid that we study or we know in our life, that is digital and analog hearing aids. Digital hearing aids are more complex than analog hearing aid, but in daily life or in routine, if we recommend to the patient hearing aid, we recommend the digital hearing aids because there are too much benefit of digital hearing aids. A patient can reduce background noises, low level noises, refrigerator or tube light noises. We can reduce these noises through programming in digital, but in analog we don't have an option to reduce these background noises. Digital hearing aids, most modern hearing aids work by passing signal through a digital circuit that is called digital signal processor. But in analog hearing aid, we don't have a digital processor that can control the background noise, cannot do the programming in analog hearing aid. This is comparison of analog and digital hearing aid. Analog hearing aid is a simple one, then the digital hearing aid. Digital is complex structure because it control many features and many options other than the feature that control noises and other features, such as we want to listen on speech frequencies, or we want to listen on higher frequencies, or we want to listen on low frequencies. Then we can adjust these frequencies through channels or through programming in digital hearing aids. Then if we want to know about more than the basic types, analog and digital hearing aids, we have air conduction hearing aid and bone conduction hearing aid. Air conduction hearing aids are those hearing aids that are worn through ear, at the ear or in the ear, and bone conduction hearing aids are those hearing aids that are that stimulates the stimulate our cochlea or process the signal to direct to the cochlea through bone conduction. The common example that we know in bone conduction hearing aid is BAHA, that is bone anchored hearing aid. This is the picture of bone anchored hearing aid. Some of these components are processor, abutment, titanium implant, and titanium fixture. Then we have styles of hearing aids. Styles of hearing aids are body-worn hearing aids, spectacle type hearing aid, behind the ear, in the ear hearing aid, in the canal hearing aids, completely in the canal hearing aid, and receiver in the canal hearing aid. These type of hearing aids are available in analog and digital, but sometimes some types like in the canal, completely in the canal, and receiver in the canal, mostly available in digital form, that we can program it according to patient specification, because all the patient have different degree of hearing loss, different category of hearing loss, different symmetry of hearing loss, so we can program the hearing aid according to their choice, according to their condition of hearing loss. First of all, if we came across the body-worn hearing aid, it is a It was used by the people before this fast technology era. In this fast technology era, people use mostly the programmable hearing aid. This is not the programmable hearing aid. This body worn hearing aid is basically a you can say a pack of playing card. You can see in this picture, this is a body worn hearing aid compartment, and a receiver is connected to a cord. This was used by people have profound degree of hearing loss, and this is not the digital hearing aid. This is only the analog hearing aid, which simply receive the signal and then convert the signal into electrical and then again into acoustic signal and received by the patient. Then we have spectacle type. If a patient have both hearing loss problem and vision problem, then we go for the spectacle type hearing aid, because the hearing aids are attached with the spectacle and patient can wear and can listen through that hearing aid. Then we have behind the hearing aid, mostly used hearing aid in daily routine. If we, as an audiologist, I recommend a hearing aid to a younger children with profound hearing loss, or an older adult like 70 years old or 80 years old with severe degree or moderate degree of hearing loss. I will recommend the behind the ear hearing aid, because it is easy to use, but in digital form. In digital, we can reduce the background noise and many other options we can avail through digital technology. BT hearing aids consist of a hard plastic, and then same process will go through it. Like microphone will receive the signal and convert into the acoustic signal, receive the acoustic signal and convert into the electrical form, and then amplifier will amplify that electronic signal, and then receiver will again convert into acoustic, and then a patient can listen the sound through it. This is a picture of behind the ear. You can see here is a small picture also. A patient is wearing the behind the ear hearing aid. One part is behind and other that is acoustic coupling through a mold. A mold that sends the acoustic signal to the ear canal. Here are the some component in the hearing aid, that is microphone, amplifier and battery. In the ear hearing aids, in the ear much smaller than the BTE hearing aid. In the ear hearing aid is worn in the ear, that is only single component, that is hard plastic made. This is not recommended to the young children because it is difficult to handle, and its level of amplification is not just like the BT hearing aid. BT can amplify more amount of signal as compared to in the ear hearing aids. Canal hearing aids. Canal hearing aids mostly used by the younger. Due to social stigma, younger children use the canal aid. If a younger person have hearing loss and he want to use a hearing aid that someone couldn't see in his ear or in the canal, I will recommend her a canal aid or completely in the canal aid. The canal aid is made to fit the size, shape of a person ear canal. A completely in the canal hearing aid is nearly hidden in the ear canal. Both the types used for mild to moderate hearing loss. Then they are usually not recommended for children or for people with severe to profound hearing loss because their size reduces the limit with their power and volume. As I say earlier, in the canal aids we have advantage and we have disadvantage also. We cannot go for a maximum power output. There is a limit for the amplification in completely in the canal, and in the canal we can go for moderate to severe degree of hearing loss. If a patient has severe degree of hearing loss and severe to profound degree of hearing loss, we couldn't recommend her completely in the canal or invisible in the canal hearing aid because due to the limitation of power output. Here is a picture of completely in the canal. If a person is standing or sitting in front of someone, a person couldn't see the patient is or person is wearing the hearing aid. If I am sitting the parallel to the person, I can see the hearing aid in his ear canal. Again, a picture of completely in the canal hearing aid. Then this is invisible in canal. This is also a canal aid, and it is more invisible than completely in the canal hearing aid. Then we came across the hearing aid batteries. As the size reduces, as the hearing aid size reduces, the battery size also reduces. In BT hearing aid, we use 675, and then in the ear we use the 13 number battery, and then in the completely and invisible in canal we use 312 to 13 and 10 number battery. How we can maintain, this is important topic for audiologist, because an audiologist have to counsel the patient about the maintenance of hearing aid, and for the patient is also important to know how a patient can maintain and can do maintenance of the hearing aid. First of all, prevent it from the falling down. Don't spill liquid on the hearing aid, because hearing aids are not the waterproof aids. Protect it from dust, dirt and heat. Remove the battery from hearing aid when it is not in use. Remember to detach the ear mold when the receiver before washing the mold. You can wash the mold but couldn't wash the hearing aid because hearing aids are not waterproof. Receiver shouldn't be come in contact with the water. A receiver shouldn't come in contact with the other, as if it will contact with water, it will stop working. So if the receiver will stop working, or if the microphone will stop working, the hearing aid automatically stop working. So after this lecture, student will be able to tell about what is a hearing aid, what is the working of hearing aid, what are the components of hearing aids, type of hearing aids, and how we can maintain a hearing aid. Thank you.